The Canadian Drug Policy Coalition is launching a fight in support of supervised consumption sites across the province after the Ford government paused funding applications following the shooting death of Carolina Hubner-Macarat just steps away from this Leslieville clinic last summer.
My goodness, it's a completely isolated incident.
Michael Parkinson is one of the co-signers of an open letter to the province, which says the shooting that killed the Leslieville mother near the South Riverdale Community Health Centre's supervised consumption site must not prevent people in diverse locations across the province from accessing vital health services any longer. But Derek Finkel, an investigative journalist who lives across from the Leslieville site, takes issue with the coalition's language and says the community had notified site managers of safety issues for years prior to the shooting.
So I actually find it offensive for people who are calling that an isolated incident, and that it shouldn't have any bearing on how supervised injection sites are managed. It's actually reprehensible to me and to my community.
But the coalition of 51 community groups says the province's decision to stop processing applications altogether for more than 7 months is punitive and irresponsible, and wants to see action taken by March 29th, when supervised consumption sites in Timmins and Sudbury will run out of funding.
So one, fund the existing sites so they don't have to close down. Number two, approve the applications that have been sitting on desks for years.
In 2018, the Ontario government capped funding to 21 consumption and treatment service sites. The coalition says to date, the province has only approved and funded 17 locations. But the Ministry of Health is holding strong on its move to pause all new applications, telling CityNews in part, following the tragic incident in July at the Riverdale Consumption and Treatment Service site, the ministry launched a review of all 17 provincial CTS sites and a third-party review led by Unity Health of the Riverdale site. These reviews remain ongoing and will inform the next steps taken by the Ministry of Health, including funding, location, and application decisions. But Finkel says the current model is not working.
So really, these supervised consumption sites are only providing a service to a very small number of people, and unfortunately, they have an impact on a much larger group of people because of the activities.
A class action lawsuit has been proposed against the South Riverdale Community Health Centre by several Leslieville residents, blaming the city, province, and centre for the neighbourhood's rapid deterioration since the site was opened 6 years ago. In Leslieville, Michelle Mackey, City News.